Aloha, I'm Wendy Osher, and today we're doing a special update focused on the state's COVID-19 response efforts. We're joined today by Governor David Ige, who just last week issued a 10th supplementary emergency proclamation related to the pandemic. Welcome, Governor Ige.
Oh, thank you so much for having me on, Wendy. I appreciate the opportunity to talk to your listeners and viewers.
We're going to jump right into questioning. With 4 new COVID-19 cases reported on Maui yesterday and ongoing double-digit increases on Oahu, as well as a 25th death reported today, is there a threshold identified for when inter-island travel is no longer considered safe?
We don't have any explicit or objective numbers, Wendy. We are looking at the entire situation, besides the COVID cases and the specific activities and the fatalities. We are also looking at hospital capacities, the ability to test and get results back within 24 to 48 hours, and then contact tracing and our ability to identify those who may be exposed by those infected with COVID, and then our ability to respond. And so looking at all of those factors, we do continue to believe that it's safe to allow inter-island travel here in the state, and that we still see that the prevalence rate of the virus in each of the counties are very similar in terms of a per capita basis.
Okay. Many in Hawaii consider the launch of the state's pre-travel testing program as the best indicator for when tourism will return to the islands. Given the reopening of schools and the ongoing surge of cases on the mainland, is September 1st a realistic timeframe for reopening travel to those coming from the mainland?
We do believe and are looking at all of those factors as we make decisions regarding reopening travel, trans-Pacific travel specifically. As you know, when we had announced the August 1st date back in July, we did anticipate, actually, we made that announcement in June, that things were looking very good here in the state of Hawaii. The number of cases were low, or at least stable. And the virus wasn't out of control on the mainland. Subsequent to that, we've seen the explosion of cases. California continues to set new daily records of COVID positive cases. Arizona, Texas, and Florida continue to have similar kinds of experiences. And as we discussed, with the public schools reopening scheduled for August 4th, we believe that it was in the best interest of everyone to delay the start of pre-testing trans-Pacific travel to September 1. We have made progress. We continue to implement the program as if August 1st still was the deadline. There's much work that the state and the counties need to do to create a system that we feel confident can protect the public's health and well-being. And we will assess what the conditions are as we approach September 1 to make another decision about whether we're ready, and more importantly, whether the virus is contained in those markets that are most important to us here in Hawaii.
Great. The Hawaii State Teachers Association, on the subject of schools, says school buildings are not ready to open, and they're urging the state to delay in-building instruction. They provided a list of questions that they say are still not answered, including clear protocols for mask use. Are schools ready, and do you feel that this opening is in any way rushed, given the outstanding concerns raised by the HSTA?
I don't believe that the reopening is in any way rushed. If you look at the conditions here in the state of Hawaii, and one of the keys to our success has been the fact that our decisions have been based on the data and the conditions that we see here in the state of Hawaii, as well as around the country. So again, we continue to have the lowest per capita rate of infection here in the islands. And, a couple of other health statistics. One of the things that they are tracking, especially on the mainland in these states where the virus is out of control in California and Arizona and Texas, it's the rate of positivity. So the percentage of those tested who test positive. And the CDC guidance is that ideally you want to be below 5%. They say that anything over 10% says that you have a problem, that the virus is active and spreading in your community, and you have to do a better job of getting it under control. Our percent of positivity here in the state of Hawaii has been below 2% for the entire time. And in most of the instances, it's less than 1.5%. So we don't have the virus activity that we see in these other communities. You know, some of the other questions that were raised by HSDA, the notion that we don't have protocols for when a student or a teacher or staff member tests positive. We do have protocols about what happens when someone is infected in the workplace, and clearly those guidelines would apply in a school situation. But I have directed the Department of Health to work with the Department of Education to write up protocols specifically applicable to the school situation. I do believe that the Department of Education and the Board of Education has a very good plan. It's comprehensive. I do believe that the indicators that we track tell us that it's safe and healthy for our community to reopen schools for both face-to-face as well as the blending learning environment. As you know, Wendy, most of the schools are moving to that blended environment where students would be in teleschool, learning from home during part of the time, and in the classroom doing face-to-face work part of the time. And that way, we would be able to enforce the physical distancing of 6 feet between students and teachers and staff, as well as implementing the masking procedures. I know that there has been some questions raised by HSDA regarding the mask policy, and we have had detailed conversations now with the superintendent and the public employee unions to talk about the masking policy. And it is clear, and what discretion they're giving to schools really deal with the youngest children. You know, as you know, kindergartners to grade 2, you know, the maturity might not be at that level where the mask actually can be used for what its purpose, you know, to keep individuals from infecting each other. You know, the concern is that that they would end up playing with the mask, and that it would be more of a magnet to attract disease than it really would provide for the benefit of the children. You know, in addition to that, Dr. Park, in speaking with pediatricians, you know, recognize that being able to observe speaking and social interactions, especially for young children, is just a critical part of the learning, and that without that, you know, that face-to-face ability, that it may impact the learning that occurs. So the guidelines are clear. Teachers and principals would have some discretion in making decisions about what's best and appropriate for the children in the classroom.
Okay. The University of Hawaii's Economic Research Organization most recent baseline forecast envisions total employment not returning to its pre-pandemic level until the year 2029. What do you envision in the years ahead, and what does the next decade of Hawaii look like?
It will be a very tough and slow road to economic recovery. All of the businesses and the industry people that I've talked to have said that. Wendy, all around the world, the entire hospitality industry is doing a reset. We were on record pace. You know, we had 7 years of record arrivals and visitor spending here in the islands, and the entire industry global travel in general just increased tremendously with people being able to travel at a lower cost all around the world.
Mhm.
This pandemic has really taught us that there are infectious diseases, and people are concerned about traveling in general. So the indications are that it will be a slow road to recovery. I'm probably more optimistic than the economists at UHERO. I think that we see a lot of signs that tell us that Hawaii will be at the head of the pack in terms of welcoming trans-Pacific travelers back to the islands. We do have survey data from most of our key markets that show whether it be Japan or Korea or within the domestic United States that although people may not be ready to travel right now, that if they choose to travel and when they get more comfortable about traveling, they do want to continue to travel to Hawaii. And we definitely will be working that into all of our plans as we work to reopen our hospitality industry here in the islands.
Okay. What do you think of the latest unemployment numbers for June? While there was a significant improvement month over month, the state says that there were COVID-19 related discrepancies to the count. Does this impact the state's share of funding or attention to help those that are impacted by job loss?
We are committed to helping those who continue to be unemployed here in the islands. I was surprised by the improvement. I had hoped, and we have been working on various programs, as you know, the Paycheck Protection Program that so many of our small businesses here in the state of Hawaii were able to qualify for has helped tremendously businesses and organizations bring back employees during this pandemic. So we do anticipate that we need a lot of work to get all of the people who were employed prior to the pandemic to get back to work. But we're committed to working with the business community and all organizations to try to restore the Kama'aina economy first, and then looking forward to bringing trans-Pacific travelers back to the island so our economy can get really going in a robust way.
Okay. So on the same topic of unemployment, there's that $600 weekly federal plus up payments that are set to expire at the end of this month. Is the state planning any further assistance to help sustain the 80,000 to 117,000 people that remain unemployed?
Yes, Wendy. I was on a call with the National Governors Association this morning, and further assistance for those who continue to be unemployed is a common priority for governors, both Democrats and Republicans, as we know that our economy has been greatly impacted during this pandemic. As you may be aware, the legislature had appropriated CARES Act funds to provide $100 per week supplemental payment to those who continue to be unemployed through the end of the year. We are looking at both of those conditions and really finding ways to support individuals, organizations in our community so that people can continue to work and can continue to help grow our economy here in the best way possible.
Okay. This is a question from one of our viewers. Stanford University, a scientist there, recently wrote an opinion piece calling the lockdown response a once in a century evidence fiasco. What would you say to those comparing COVID-19 to the death rates of the flu? Is it a valid comparison?
I don't think it's a valid comparison. And clearly, I think when you take the entire COVID response of the United States, beginning in late January through the current situation, I think everyone would agree that the US response to COVID has not been a very good textbook situation. We still continue to see record new cases in California, in Arizona, in Texas, and Florida. And so the US experience is very different than the experience that we have here in the islands. It has been an unprecedented situation. I don't think that there has ever been an infectious disease that has really spread throughout the world so quickly. The challenge now is that it does spread person to person quite readily. And unless we all take concerted effort, it would not be able to be contained. We are fortunate. I'm proud to be governor of the state of Hawaii because virtually all of our residents had taken the calls for staying at home, wearing your mask, staying home when you're sick, and washing your hands to heart. And really, the results that we see is truly a community effort. We are seeing cases where the total number who've passed away from COVID-19 is now exceeding the number who pass away in a typical flu season. So the impact and the mortality rate of COVID-19 is definitely higher than influenza or the normal flu strains. And I do think that that's what causes a lot of the anxiety and concern in our community to see so many of our friends and neighbors, across the country impacted, getting very sick from COVID-19, and so many becoming fatalities.
Well, I understand that you spent some time on Maui in Lahaina as a child. So you've obviously seen the transformation of the West Side from a sugar town to one that's now dependent on tourism or has been dependent on tourism. What happens with these large hotels that are now sitting empty? And is there an effort being made to diversify the economy?
We are definitely doing two things, Wendy. Clearly, helping to restart the hospitality industry still is the core of moving Hawaii forward. There is so much infrastructure to support trans-Pacific visitors, and it is such an important part of our economy. More than 20% in some of the counties. That we cannot ignore that. That's the quickest way to getting people back to work and increasing the economic activity in our communities. But on the other side of that, and Maui County has been one of those most impacted, once we implemented the 14-day mandatory quarantine, we saw the unemployment rate skyrocket to levels that we've not ever seen, probably even before the war. So we know that the economic impact has been widespread and devastating. So we are looking at a couple different things. I'm excited about how quickly our community was able to embrace technology. And, when you think about Wendy doing this interview via Zoom or WebEx, we probably would not have done it. I mean, we could have done it in the past, but I probably would have flew over to Maui and we would have done this interview face to face. Everyone in our community has embraced technology, and I'm certain virtually everyone has participated in a virtual teleconference now and been engaged. All of our employers have been encouraged to embrace telework and people working from home. And that phenomenon has gone on all across the country and around the world. So I think all of those things really mean for us here in the islands, virtually every business, we can't compete with many businesses that we thought were really out of reach. People in Hawaii can get jobs working for virtually any company anywhere. as every business has embraced telework and brought people on board. And clearly, nobody would ever deny the fact that probably living and working in Hawaii is the best place to live and work. And so I'm excited about the opportunity. You know, we're working with the University of Hawaii and the community colleges, Maui College, to really think about how the university can be a catalyst to thinking about how we need to do a better job in ensuring that our residents have the skills for the many jobs that are currently in our economy, but that we can't find qualified candidates here. You know, we need to look at every opportunity to support entrepreneurs and businesses in seeking sales and businesses outside of Hawaii. You know, this COVID-19 pandemic has really proved that we can support businesses who are not headquartered here. Employees can work virtually any place in the world. And if we're smart about making investments in infrastructure, in our education system, we can position our community, our citizens, to take advantage of both of those ideas.
Okay. Well, I think we've come just about to the end of our time together. Do you have any closing thoughts or anything specific to Maui that you'd like to share? Any updates?
Yeah, thank you, Wendy. I just would want to thank you for giving me this opportunity. And once again, thanking all the people of Maui County. You know, Hawaii continues to lead the world in our COVID-19 response. And it is because all of us have taken personal responsibility and have done the things that we've asked. You know, stay at home when you're sick, wear your masks, wash your hands. All of those things have a tremendous impact in our success. So I just want to thank everyone in Maui County for their support. I want you to know that I'm working with Mayor Mike Victorino and all of the elected officials to think about what we can do to alleviate some of the challenges that we're all facing as a community. You know, the food, the rent challenges, the business closures and the layoffs, I think are all impacting our quality of life. But if we are committed to work together, we will emerge from this crisis a much stronger and more vibrant community moving forward. So just thank you to everyone on Maui.
Thank you again, Governor David Ige, for joining us. If you'd like more information or details about topics covered today, visit us at MauiNow.com. For Maui Now, I'm Wendy Osher.